Today, we're diving into something that feels like it's straight out of science fiction. We're talking about a massive shift in how we heal, using the most powerful, most personalized medicine on the entire planet, our very own blood. So let me start with a big question for you. What if the most advanced pharmacy, perfectly designed just for you, wasn't in some high-tech lab, but was already flowing through your body? What if we could finally tap into that incredible power to fix injuries, make skin look younger, or even help fight disease? It sounds almost too good to be true, but it's happening, and it's closer than you might think.
All right, to really get where we're going, we first have to understand where we've been. For a while now, the big promise in this world of regenerative medicine has been a treatment called PRP.
So what exactly is PRP? Well, the idea is actually brilliant and pretty simple. We take a little bit of your blood, we spin it down in a special machine, a centrifuge, to separate it out into layers. Then, we collect the part that's just packed with platelets. See, platelets are your body's emergency response team. When you get hurt, they rush in and release all these powerful growth factors that basically tell your body, hey, time to repair and rebuild. It's like sending a supercharged construction crew right to the injury site.
It sounds amazing, right? And for some people, it really has been. But let's be real. The story of conventional PRP has often been one of frustration. The promise didn't always quite match up with the results people were getting.
A lot of patients found that the injections could be surprisingly painful, and doctors noticed that the results were kind of a roll of the dice. It might work wonders for one person and then do almost nothing for the next. So what gives? Why was it so hit or miss? Well, it all comes down to how the old-school PRP was actually made. And here's the key. The old way isn't 100% natural. To get those platelets ready to go and to stop the blood from clotting up in the tube before it's injected, chemicals have to be added. Things like heparin are used to prevent clotting, and other activators are tossed in to try and kickstart the healing process. And, well, this is where the trouble really starts.
This table really breaks down all the issues perfectly. Just look at this. Those chemical activators, they're often the reason for the pain and inflammation right where you get the shot. And the anticoagulants? Get this. Some studies show they can actually slow down the very healing you're trying to boast. On top of that, traditional PRP only uses this tiny little fraction of the blood called the Buffy code, which means a ton of healing potential gets left on the table. And the growth factors it does release? They come in one huge quick burst that just fades away fast. And it all leads to that bottom line, inconsistent results.
So for years, that was the trade-off. You had a great idea, but it was held back by a flawed process. But what if you could get all of the incredible benefits with none of those drawbacks? Well, this is where a massive breakthrough called ACTEL Bio enters the picture.
This is the huge question that ACTCell Bio set out to answer. And it's a total paradigm shift. Instead of adding a bunch of stuff to your blood, it uses physics to unlock its power in a way that is 100% pure and natural.
So how on earth does it work? Instead of chemicals, the ACTCell Bio system uses a controlled physical force. You can kind of think of it like a very precise, very gentle vortex that mechanically wakes up all the healing parts of your blood. And it doesn't just wake up the platelets. It activates everything. The platelets, the white blood cells, and it even taps into the power that's been hiding inside red blood cells. The final product is purely you. Nothing added, and it's fully activated and ready to get to work healing.
Now, this is one of the biggest differences, and it's honestly why this technology is such a game changer. It goes way, way beyond that little Buffy coat layer that traditional PRP was stuck with.
And this slide just lays it out perfectly. On the left, you've got your conventional PRP, just skimming that tiny yellow layer off the top. But on the right, you see the ACTCell Bio approach. It uses the whole Buffy coat, it uses the platelet pore plasma that used to be thrown away, and, this is so important, it uses part of the red blood cell layer too. Nothing is wasted.
Yeah, that last part is the secret sauce. For the longest time, everyone just ignored the red blood cells. But this physical activation process is so gentle and so precise that it can actually open up some of them to release a whole new universe of healing compounds that we were literally just throwing in the trash before.
So what's actually in this hidden treasure trove? You get exosomes, which are like tiny little text messages sent between your cells telling them to start regenerating. You get mitochondria fragments, which are basically little bioenergy power packs that help fuel the healing tissue. And of course, you get a much richer and more diverse mix of growth factors, our construction crew, and cytokines, which act like the project managers directing the whole healing process to make sure it's done right.
Okay, so all this science is fascinating, for sure. But what does it actually mean for a patient, for you or me? The answer is everything. The difference this makes in the real world is just dramatic.
Let's start with the most mind-blowing number. From the exact same amount of blood you'd give for old-school PRP, the ACT cell biosystem gives you about 15 cc's of activated plasma, instead of just 2 or 3. That's 5 times more medicine. For a patient, that could be the difference between treating one sore knee or being able to treat both of them. It means more healing power, delivered more effectively, all from one simple blood draw.
This comparison table, this tells the whole story. Just look at the difference all the way down. Pain? The old way is often painful. ACTel Bio is virtually painless because there are no irritating chemicals. Safety? You get rid of the risk of allergies and inflammation. But for me, the most important lines are growth factor release and efficacy. Instead of one quick burst, ACTel Bio gives you a sustained release of healing factors for up to 2 weeks. And that leads to exactly what every doctor and patient wants: consistent, long-lasting results.
And the innovation doesn't even stop there. Because this system is totally chemical-free, it's been able to do something that was thought to be impossible: create a version of something called platelet-rich fibrin, or PRF, that you can actually inject.
PRF is kind of like a next-level version of PRP. It creates this amazing healing scaffold, but it was always too thick and clumpy to inject easily. By using physical activation, ACT Cell Bio creates a PRF that stays liquid long enough to be injected, is totally free of any additives, and gives you that incredible 10 to 14 days slow release of growth factors. It's truly the best of both worlds, with almost no pain and 0 risk.
So when you put all of this together, the purity, the power, the consistency, and how versatile it is, you're not just looking at a slightly better version of PRP. You are looking at a whole new way of thinking about regenerative medicine.
This timeline really puts it all into perspective. You had the first generation, PRP, which was all about concentrating platelets. Then came the second generation, PRF, which was about creating a natural healing scaffold. And now we're entering the third generation, fully activated, chemical-free therapies that do both and do them better than ever before. It's the natural evolution of learning how to work with our body's own amazing systems, not against them.
And because this is such a fundamental improvement, the applications are just unbelievably broad. We're talking about everything from orthopedics for joint pain, to dermatology for making skin look great, to hair restoration, to healing serious wounds. Even new uses in dentistry and eye care. Basically, anywhere the body needs to heal itself, this technology could be a huge help.
The big takeaway here is this. We've spent more than a century creating incredibly complex drugs in labs to treat our symptoms. But this new technology suggests that the future is about something far more simple and far more powerful: unlocking the healing intelligence that already exists inside every single one of us. It's a huge shift in thinking, and it really seems like we finally have the key.